Hello everyone, welcome back to class. Look at the hand in the picture. What issue do you observe? It seems everyone has noticed that the finger wearing the ring is swollen. Why is this? Some students say it's because blood can't flow back. Is that really the case? Today, we will learn the physiological principles behind this. Reviewing the previous lesson, we learned about microcirculation, and know that material exchange in tissues primarily relies on the circuitous channel. When blood flows into the true capillaries, plasma filters through the capillary walls into the interstitial space. Nutrients dissolved in the plasma consequently enter the interstitial space. This plasma filtered out of the vessels is called interstitial fluid, which is the internal environment upon which cells depend for survival. Most interstitial fluid is gel-like and cannot flow freely, thus it does not drain to dependent parts of the body under gravity. Even inserting a syringe needle into the interstitial space cannot aspirate this fluid. The diffusion of water and dissolved solutes within the gel is not hindered, allowing material exchange with blood and intracellular fluid to continue. Due to the selective permeability of capillaries, the ionic composition of interstitial fluid is the same as plasma, but there is a significant difference in protein concentration between interstitial fluid and plasma. Under normal conditions, interstitial fluid is continuously produced at the arterial end of capillaries. Simultaneously, a portion of the interstitial fluid returns to the capillaries at the venous end. Another portion drains back into the circulation via lymphatic vessels. Therefore, the volume of normal interstitial fluid is in a state of dynamic balance. This dynamic balance depends on the combined action of four factors: capillary blood pressure, interstitial fluid hydrostatic pressure, plasma colloid osmotic pressure, and interstitial fluid colloid osmotic pressure. Among these, capillary blood pressure and interstitial fluid colloid osmotic pressure are forces promoting filtration of fluid from inside the capillary outward, whereas interstitial fluid hydrostatic pressure and plasma colloid osmotic pressure are forces promoting reabsorption of fluid from outside the capillary inward. The difference between the forces favoring filtration and those favoring reabsorption is the effective filtration pressure, EFP. It can be expressed by the following formula. Effective filtration pressure equals capillary blood pressure plus interstitial fluid colloid osmotic pressure, interstitial fluid hydrostatic pressure plus plasma colloid osmotic pressure. If the EFP is positive, it indicates net filtration of fluid out of the capillary. If it is negative, it indicates net reabsorption of fluid back into the capillary. The volume of fluid filtered through the capillary wall per unit time equals the product of the effective filtration pressure and the filtration coefficient, Kf. The magnitude of the filtration coefficient depends on the permeability of the capillary wall to fluid and the surface area available for filtration. The filtration coefficient varies greatly among capillaries in different tissues. It is very small in brain and muscle, but very large in liver and renal glomeruli. Overall, about 0.5% to 2% of the plasma flowing through capillaries is filtered out into the interstitial space at the arterial end. About 90% of this filtered fluid is reabsorbed at the venous end, and the remaining approximately 10%, including filtered albumin molecules, enters the lymphatic capillaries, forming lymph. Normally, the formation and reabsorption of interstitial fluid maintain a dynamic balance. Thus, the total volume of interstitial fluid remains relatively constant. If this dynamic balance is disrupted, causing excessive formation or reduced reabsorption of interstitial fluid, excess fluid accumulates in the interstitial space, leading to edema. Recall the picture we saw at the beginning of class. It showed an example of edema in the index finger. What conditions can disrupt this balance? Looking back at the effective filtration pressure formula, this is the driving force for interstitial fluid formation. Therefore, any factor that affects the effective filtration pressure can potentially disrupt the balance. Let's rearrange this formula. On the right side of the equation, the first parenthesis represents the difference between capillary blood pressure and interstitial fluid hydrostatic pressure, termed the effective capillary hydrostatic pressure, which is the main factor promoting interstitial fluid formation. An increase in systemic or local venous pressure is the primary cause of increased effective hydrostatic pressure. For example, right heart failure can increase systemic venous pressure, impede venous return, increase post-capillary resistance throughout the body, lead to increased effective capillary hydrostatic pressure, and cause systemic edema. Due to gravity, systemic edema often starts in the feet. Local increases in venous pressure can be seen in thrombosis obstructing a vein, or tumors or scars compressing the venous wall. This type of edema is often asymmetrical. The second parenthesis on the right side of the equation represents the effective colloid osmotic pressure. It is the main force limiting interstitial fluid formation. Plasma colloid osmotic pressure depends primarily on the concentration of plasma proteins, especially albumin. When plasma proteins are reduced, such as in malnutrition or certain liver or kidney diseases, the plasma colloid osmotic pressure decreases, leading to a decrease in the effective colloid osmotic pressure, an increase in the effective filtration pressure, and consequently, edema. Furthermore, changes in capillary permeability can also cause edema. Normally, capillary walls are almost impermeable to proteins, thereby maintaining a normal effective colloid osmotic pressure. However, in conditions such as infection, burns, or allergies, capillary wall permeability is abnormally increased. Plasma proteins can leak out with the fluid, causing plasma colloid osmotic pressure to fall and tissue colloid osmotic pressure to rise, increasing the effective filtration pressure, leading to increased interstitial fluid formation and edema. Finally, impaired lymphatic drainage can also cause edema. Because approximately 10% of the fluid filtered from capillaries needs to return via the lymphatic system. The patency of the lymphatic system directly affects interstitial fluid reabsorption. Additionally, the lymphatic system can compensatorily increase its drainage when interstitial fluid formation increases, preventing excessive fluid accumulation in the interstitial space. However, under certain pathological conditions, such as when lymphatic vessels are obstructed by filarial parasites in patients with filariasis, lymphatic drainage is impaired. This leads to accumulation of protein-rich lymph in the interstitial space, resulting in lymphedema. But with China's rapid economic development and improved sanitary conditions, the incidence of filariasis has greatly decreased. Clinically, impaired lymphatic drainage is now more commonly seen post-radical mastectomy for breast cancer or post-radical surgery for pelvic malignancies, where dissection of regional lymph nodes leads to edema in the patient's upper or lower limb. In the 1980s, German Dr. Emil Vater proposed complete decongestive therapy, CDT. This is an improved decongestion method based on manual lymph drainage, augmented with personalized skin care, compression bandaging, and functional exercise. CDT is a non-invasive, safe, effective, and convenient treatment method, currently primarily used for treating chronic lymphedema. It can be applied to swelling from various causes and has achieved definite and reliable therapeutic outcomes. Returning to the question at the start of class, why did the finger wearing the ring become swollen? Can you tell me the answer now?